Congratulations on the very fine Tri-Committee draft proposal for health care reform. It is an impressive accomplishment, worthy of the challenge we face to make health coverage available, affordable, and adequate for all Americans. Your hard work and wisdom and practicality and that of your excellent staff is evident in this proposal, and this time I know you will get the job done. Your proposal defines a minimum health benefits standard. It requires all Americans to have at least that level of coverage with shared responsibility for paying for that by employers. It creates tax credits for small businesses. It expands Medicaid and creates new premium and cost-sharing subsidies for private insurance coverage to help other Americans of modest means. The proposal also establishes strong new market reforms for private insurance with important consumer protections. It creates a new health insurance exchange, an organized marketplace that will give consumers, individuals, and small employers a great deal of assistance with enrollment, appeals, application for subsidies, provide comparative information about plan choices, and on their behalf, the exchange will negotiate with insurers over the premiums for health insurance in order to get the best possible bargain. And importantly, consumers and employers who buy coverage in the exchange will also have the choice of a new public plan option. You've heard about the recent national poll that indicates Americans strongly favor such an option. It can address the failures of competitive health insurance markets today. First, it offers consumers an alternative to private health plans that for years have competed on the basis of discriminating against people when they are sick. Just last week, your colleagues on the Energy and Commerce Committee held a hearing on health insurance rescissions. One woman who was battling breast cancer testified that her coverage had been revoked for failure to disclose a visit to a dermatologist for acne. When consumers are required to buy coverage, having a public option that doesn't have a track record of behaving in that way will give many peace of mind. And second, a public plan option will promote cost containment. Research shows that insurance markets today do not compete to hold down costs. Rather, insurers and providers negotiate to pass costs through to policyholders while maintaining and even growing profits. For the first few years, the public plan option will be allowed to base its payments to doctors and hospitals on the fee schedules used by Medicare. Thereafter, it will develop innovative payment methodologies to hold down costs and promote quality. Mr. Chairman, clearly, as this bill moves through the legislative process, there will be opportunities to modify and improve it, and in my written statement, I offered several recommendations in that regard and would briefly just describe three of those for you now. First, with respect to the essential benefit package, the bill does create a benefit standard, and it appears to be a solid one, but it doesn't create an out-of-pocket limit on cost sharing for care received outside of a plan network, and that is an important omission to correct. And your bill does not specifically reference as a benchmark the Blue Cross Blue Shield standard option plan offered through the FEHBP today. Many have talked about that plan, which so many members of Congress have as coverage today as being an appropriate benchmark of minimum coverage for all Americans. It's not clear whether your essential benefit package meets that standard, but it should, and if it doesn't, the standard should be improved, and if that raises the cost of the bill, it will be imperative to find additional resources. Over the next decade, our economy will generate more than $187 trillion in gross domestic product, and we will spend a projected $33 trillion on medical care. Investment in health care reform that guarantees adequate protection for individuals and families is worthwhile. Second, with regard to rules governing health insurance, new rules won't be meaningful unless there are resources for oversight and enforcement. After the enactment of HIPAA, a witness at a congressional hearing for the Department of Labor testified that the department had resources to review each employer-sponsored health plan under its jurisdiction once every 300 years. For health reform bills, your final health reform bill must appropriate resources for the Department of Labor as well as for HHS and state insurance departments so that there is capacity to oversee and enforce the new standards. Your colleague on the Appropriations Committee, Congresswoman DeLauro, has introduced legislation to do this, and I hope you will work with her to accomplish that. And finally, with regard to subsidies, the bill creates sliding scale assistance so that middle-income Americans with incomes up to 400% of the poverty level will not have to pay more than 10% of their income toward premiums. As charts in my written statement illustrate, however, some consumers, including self-employed, who have been mentioned a lot today, who have incomes above that level may still face affordability problems. This is especially likely for people who have to buy family coverage and for baby boomers who could face much higher premiums under age rating that is allowed under this bill. I hope the committee will consider setting a premium cap so that no American has to spend more than 10% of their income on health insurance. Thank you very much.